Dr. Patino here at the Cosmetic Surgery Center of Cerrito. We're doing power-assisted liposuction, high definition of the abdominal wall. And look how beautiful this output is, huh? What do you see there, Emily?
Yellow fat in there.
Yellow, beautiful fat, but we waited over an hour before we started. The patient is instructed not to take any aspirin-like medications, no heparin, no ibuprofen, no herbs. The surgeon does not use any heparin or enoxaparin or aspirin or any medications that would cause bleeding, right? And that's how you can obtain these incredible aspirate. And probably the most important thing are my slow strokes. So I go very slowly and I'm very meticulous. So not only do we wait an hour for the tumescent anesthesia to detumesce, which is what you're supposed to do, but also my slow strokes. It's like driving. If you drive too fast, you know, you're gonna crash basically. So the speed kills. So she's not gonna have a fat transfer to the buttocks. We already did an incredible fat transfer to her. Her buttocks are absolutely gorgeous. So we're now going to further define her abdominal wall muscles. That's what we're doing. But that output is almost white, isn't it?
Yes.
It's incredible. It's a pure, beautiful fat. And if she was going to have a fat transfer, she's not going to, like I said, but if she did, look at this pure fat, it's going to survive. See, normally when you transfer fat into the buttocks, you lose 30 to 50%, but I contend that a lot of it is because it's not fat where you're putting in, it's fat and blood, or fat and oil. And doing it this way, you avoid the famous oil cyst on the buttocks. You avoid also the famous blowout fractures, because I believe the blowout fracture is no more than a foreign body reaction. Like for example, if you have a piece of glass or a bullet fragment, the body is going to create a callus around it and push it to the surface, right? And that's what a blowout fracture is. It's like a light bulb that sticks out of the buttock, right? And that's a complication that happens because not only the surgeon destroys the anatomy, right? But also the fat herniates because the surgeon destroyed the anatomy, but also is, I believe, because the blood does not belong anywhere other than inside the blood vessels. So that when the blood is outside the blood vessels where it's supposed to be, what happens is that the body rejects it. And it may reject it in the form of nodularities, painful nodularities, you know. So those things you see, the painful nodules after liposuction, or the painful bands, a lot of it is fibrotic bands that form as a result of bleeding. Dr. Guillermo Blugerman, my dear friend, described this as the octopus effect. There's a central hematoma, otherwise a central collection of blood, and then the tracks of the liposuction are like the tentacles of the octopus, right? And it creates this fibrotic network. And it's something that we never have, thanks to God, but I believe it's a result of bleeding. And so look at this bloodless, oil-less aspirate, right? So if we don't put oil, there's not going to be oil cysts. If you don't put fat, if you don't put blood, there is not going to be bleeding, right? And there is not going to be a reaction to that blood that you put in there. And of course, the fat graft retention, meaning what you get to keep, is almost 100%, because it's almost 100% what you put it in here. It's all fat, right? Look at that. And we can do this consistently and all the time in all our patients. And I love doing it this way. It's really a very unique technique. Thank you. All right, so this technique also allows the surgeon to use both hands. I'm right-handed, and this is my left hand, so my non-dominant hand. But because the strokes are slow, you know, And I'm ambidextrous, so I have no problem doing it. But for those surgeons that are not ambidextrous, they can try this technique and just practice slowly, of course, with the non